We continue with our Taking Action for Your Parents campaign now in week 5. Our special reports are taking a closer look at the latest treatments and also how cancer experts are treating not just the patient, but also helping the family in these situations. You can see all the special reports being created for the campaign on our website. You can visit abcactionnews.com/yourparents. And joining us in the studios with more, we want to welcome Dr. Michael Alberts, who's the Chief Medical Officer at the nationally acclaimed Moffitt Cancer Center. Thank you so much for coming in.
Very good, thank you.
We hear so much about different cancers, and it seems like everywhere we turn, there's cancer. Is it more common? Is it more prevalent? It certainly feels that way.
Well, cancer is a disease of the elderly, and of course, as we live longer and longer, while we're more susceptible to developing cancer. And of course, the baby boomers are now getting into that susceptible age. So it appears that cancer is becoming more common and prevalent. Whether it is or it isn't, it's still going to be a major problem, major health problem for us for the foreseeable future. That's why it's important for segments such as this to appear.
We talk about treatments and technology and how things are changing and money being raised for research. So the question is, are we making headway?
Well, I would say a qualified yes.
Okay.
In some situations, we're making some major advances. Research has proven to be beneficial in designing some treatments, targeted treatments, that will be beneficial to some patients. We're not having quite the success in some cancers that we are in others. For example, lung cancer. The 5-year survival is at 15, 16, 17%, which is not good, as compared to, say, colon cancer, where the 5-year survival is 65%, 70%. So in some situations, we're making major advances. Others are lagging behind a bit.
When you have the same cancer, the same type of cancer, but you have a patient who is older than the other patient, same cancer, same treatment, or does it vary because of the age?
It varies. Just as an infant is not just a small adult.
Understood.
The 80, 90-year-old is not just an older 50-year-old. There are major differences and something that we need to have cognizance of. For example, the older patient may metabolize chemotherapy drugs differently. Therefore, there's a danger of giving too much, too often, that type of thing. So it's very important to understand, to have some expertise in the older population as to what might be best for their cancer.
So if you're a child, an adult child who's helping their parent, a caregiver, you would recommend that they really ask if the doctor has experience with that specific age group.
Important to find out.
In older patients, I understand that you all talk about the whole family, supportive care or palliative care. Do you see more of that, and explain that to us?
Well, recently there's been a real push for supportive care. It used to be called palliative care, in other words, just treatment of the symptoms. But now we're really looking into the entire patient and also their support system. They need some emotional support, some help with their physical needs. And therefore it's important to have an extra set of hands to address not only the patient's problems, but the family and the caregivers.
Right.
For example, commonly cancer patients will have constipation, will have nausea, will have pain. Those are the things that really bother them from day to day. And if we can get them treated, get them feeling better, they'll have a better sense of well-being.
Get the caregiver to know what's happening.
Therefore, the caregiver will have a better sense of well-being.
Well, thank you so much for coming in. It's such a pleasure to meet you.
Well, thank you for the opportunity.
If you would like to learn more about all the wonderful things that they're doing at Moffitt Cancer Center and the different awareness programs that they have, please call Moffitt at 1-888-MOFFITT. That's 1-888-663-3488. You can press the option number 2. Or you can visit them online at moffitt.org/cancer answers.